What's up, future doctors? Welcome back. This is Dr. Josie. This is Write Your Acceptance. Today we're diving into the AMCAS Work and Activities section, one of the most, I think, overlooked but powerful parts of your application. Most students waste this section with generic descriptions or naming the title, their job title, or the place in the 700 characters instead of storytelling, scientific clarity. And so I want to break down kind of some real student examples, talk about what works, what doesn't. And so yeah, stick around because this could change the way you write your activities. Let's get into it. Okay, so what is the work and activities section? First, quick overview. For AMCAS, you get 15 entries to describe your clinical, research, volunteer, and extracurricular experiences. 3 of these can be marked as most meaningful, which then kind of brings down a response, which is 1325 characters. And so you want to talk about your impact, your growth, and fit for medicine. 3 ways to kind of make your activities stand out, I think, is really think about changing your rhetorical, like your tonal, the way you write and speak about certain things. Many students just kind of will list what they did and don't show impact or insight, right? Sometimes you want to tell a story. As a hospital volunteer, I assisted patients bringing them water, transported them into different areas. So you want to kind of maybe change that to Mr. Smith suffered from PTSD and became restless when nurses arrived with his medication. After checking with the medical staff, I walked with him in the hallways, allowing him to release some of his anxiety while staying active. Over time, I noticed he was calmer throughout the day. Through patients like Mr. Smith, I learned to identify nonverbal distress cues and how small actions can improve patient well-being. So, and then kind of like, you went from basically narrating your bullet points of a CV to kind of zooming in into a patient experience and show you in action, shows you problem solving, observing kind of, a moment and adding value. And so the nonverbal distress cues, you want to kind of make sure that it's a story that's beyond your general list of tasks. Sometimes you will use your tasks and that's okay, but you want to change it up. So when writing science, kind of like, research, you don't want to oversimplify, you don't want to use too much technical jargon. So instead of I conducted research that improved patient care or that looked at vascular surgery, how to improve patient outcomes, you can say I collected retroactive data on patients' preoperative conditions and 1-month post-surgical outcomes. This data helped inform surgeons the relative success of interventions, whether surgical options should be considered for patients with chronic conditions such as diabetes and peripheral arterial disease. You want to find this healthy balance between kind of being scientific but not overly technical and showing what you learned, your takeaway. So break it down in a way that kind of someone that's a non-scientist could understand, but that it shows that you as a burgeoning scientist understand that there's a level, an intellectual level that you can get to, and then talk about your impact or how it impacted you. So for volunteer, a week one would be I volunteered at the vaccine clinic, I helped people with their schedule, provided information. You can change that a little bit with, I vividly recall families arriving at the clinic, hopeful yet apprehensive about the newly approved vaccine. I reassured them about its safety, drawing from my epidemiology coursework to explain herd immunity. Despite initial reservations, I noticed a shared desire among patients to protect themselves and their community. This experience reinforced my commitment to patient education and public health. This is from Jasmine. And so I think that it works well because it connects kind of classroom knowledge to real world impact. She is synthesizing kind of experiences that she's had outside of this clinic to this clinic while bringing compassion and empathy for the patients, right? So you want to ask yourself, how did the experience, whether it's volunteer or clinical, change the way you think about medicine or patient care? Maybe it didn't, but you want to think about how it did. If it did, you want to think about how you made an impact or how the experience impacted you. And so beyond kind of basic descriptions and you can get into deeper reflections a little bit. And so if you can make these connections from past experience and kind of, your future career in medicine, I don't think every experience, every activity needs to say, and as a future physician, I will. But if, 2 or 3 kind of connect something in the future, that'd be great. Okay, so what to do with your most meaningful entries, the 1325, right? You have 3 of them and you want to expand beyond your basic descriptions and provide kind of deeper reflections, right? Highlight leadership, initiative, personal growth. Make connections between your past experiences and future career in medicine. Also kind of go deeper into a patient story. This is from Jasmine again, from scribing. A 3-month-old patient, Bujar, came in with concerns about a flat spot on his head. After Dr. Santoro diagnosed him, I researched clinics that could fit Bujar with a cranial helmet. This experience exposed me to the administrative side of medicine and the importance of advocating for patients, ensuring timely treatment despite systemic barriers. So again, whenever, this is an excerpt, but whenever you can tell a story that you have direct patient impact in, it highlights advocacy, problem solving, you're navigating healthcare systems. So you want to kind of show, remember, it doesn't have to continue from the 700. It's a separate box altogether. You want to show deeper reflection or deeper impact. You can definitely use storytelling to make your experiences more engaging. And so if it's a lab, you want to kind of delve a little deeper into the scientific kind of, be clear, but into scientific descriptions. But most importantly, use the most meaningful experiences to highlight your biggest growth and insights. Also, you want to think about how the activity section complements your personal statement. I would not use the 3 most meaningful in your personal statement. There's definitely overlaps because they're most meaningful, but I would say maybe there's 2 of the 3 that kind of go into the personal statement. Sometimes it's all 3, sometimes it's just 1. I'm not saying this is perfect science, but I'm saying think about how the activities and the personal statement complement each other so that you're not repeating any information, you're kind of complementing the information. If you have Boujar in your most meaningful as a pediatric scribe, and you have that you capture that experience in your personal statement, you have another patient story, or you do something else with that experience so that it complements that information, right? And they get a different dimension of the same experience. I hope this is helpful. Make sure that you are, biggest takeaway is think about how you impacted the experience, how the experience impacted you, but also, can I tell a story here? Can I be scientific in nature while also being very clear and precise? Can I show something or share something, whether it's kind of, it changed my perspective on medicine in a certain way, or it changed my perspective on advocacy or mentorship or leadership? Can I give a different angle, something that is not captured in your CV, in resume, right? Again, hope this was helpful. If you want to learn how I work with students like Jasmine, like Anna, who also shared a couple of those excerpts for me, grab a spot on my calendar, fill out our application. I work with students from personal statement through interview prep. So you want to make sure that you are elevating your message. Grab your spot on my calendar and we can see if we're a good fit. Thank you so much for watching. I will see you soon. Take care. Bye.